A bladder tumor is a disease that occurs with the development of tumor tissue in the urinary bladder. The first complaint of bladder cancer patients at our clinic is painless, clotted bleeding in their urine. When these patients apply to our clinic, we do radiology examinations, ultrasound, tomography. And by observing inside the bladder with a camera we call cystoscopy, we estimate the location, size, structure, depth, and spread of the tumor inside the bladder. Then the bladder tumor operation, which we call TUR-MT, is performed on the patient. This surgery is an endoscopic surgery performed in a closed system. After the operation, the patient can easily do his daily work. Patients do not have any wounds or dressing. It is a simple operation. In this surgery, a camera is entered through the patient's penis. The bladder tumor is seen inside, and the bladder tumor is cut into small pieces and removed from the penis. The process can take around half an hour to an hour. A pathology result comes to us from this surgery. It tells you that two things can happen to the patient as a result of the pathology, whether the bladder tumor is deep or superficial. This pathology result constitutes the most critical point in bladder tumors, because the patient's treatment protocol is completely based on this. If the bladder tumor pathology is superficial, that is, it only affects the most superficial tissue, then the patient has already been treated. He will have 3-month checks. Treatments that reduce the risk of bladder tumor formation are applied into the bladder with some medications. The patient remains under follow-up and does not have any problems. If the bladder tumor has spread to the deep muscle tissue of the bladder, then the treatment protocol is completely different. Then, patient's bladder is taken out of the body, and it is necessary to clean the surrounding lymph nodes thoroughly. We call this surgery radical cystectomy. This is a heavy surgery. The hospital stay is long. It is an operation with a high rate of complications. After the surgery, the patient can urinate either from the abdomen, anus, or with a new bladder made from the intestines through the urinary tract. In other words, the patient's urinary tract is redesigned. As I explained, the most important thing in a bladder tumor is early diagnosis. Although some patients have bleeding in the urine, they delay coming to the doctor. And when they finally come, the bladder tumor may have spread or become extremely large. If you have painless bleeding in your urine, do not skip it and go to the doctor. Early diagnosis both saves lives and provides better life comfort in bladder cancer. Thank you so much for listening. Best regards. Have a nice day.